Welcome to the homepage of the Australasian Faculty of Rehabilitation Medicine. I'd like to tell you a little about our faculty in the next few minutes. I'd also like to talk to you about the exciting and fulfilling career that you can have as a consultant physician in rehabilitation medicine. The faculty is proud to be part of the Royal Australasian College of Physicians. We have a 4-year training program for doctors who wish to specialise in rehabilitation medicine, as well as a vibrant continuing education program for our fellowship. Our training program has been assessed and fully accredited by the Australian Medical Council in 2005. The specialty of rehabilitation medicine grew largely in response to the needs of those injured after the Second World War. People with severe injuries often died or became very disabled because of a lack of comprehensive medical, nursing and allied health care. Since the Second World War, when the numbers of doctors with a special interest in physical disability were very small, our specialty has grown to around 450 medical practitioners in all states and territories in Australia and in New Zealand. We have around 140 doctors training in rehabilitation medicine currently. We are still a relatively small specialty compared to most of the procedural specialties, and we have workforce issues along with everyone else, with a concentration of specialists in the eastern states and in the cities. However, as our numbers grow, we are becoming better able to service rural and remote areas, the smaller states and New Zealand. The majority of our graduates work in the public hospital system, although more and more are now working in the expanding private rehabilitation hospital sector and in private consultation rooms. All graduates of our faculty are recognised as consultant physicians by federal and state jurisdictions, and as such are able to claim reimbursement at the consultant physician rate. Fellows of our faculty accept patients by referral only. Rehabilitation physicians manage patients with disability in a wide range of medical areas such as head and spinal injury rehabilitation, amputee and prosthetic management, neurological rehabilitation including stroke and multiple sclerosis, rehabilitation of older people, musculoskeletal rehabilitation, pain management and workers' compensation, community-based rehabilitation, specific areas such as developmental disability, as well as burns and medical legal assessment. Many are engaged in academic research, and many of us have administrative responsibilities. We also train doctors in paediatric rehabilitation. The main role of the faculty is to train, accredit and support medical practitioners in the management of disability following an injury or illness. Rehabilitation medicine physicians are concerned about getting people who are injured or have a chronic illness back home, back to work, back to their families and back to participating in society again. We are trained to lead multidisciplinary teams involving other health professionals and other professions. It often takes many skilled people working efficiently and effectively together to achieve the best outcome for an injured or a disabled person. We are also a very functionally orientated discipline, so that we are concerned about what a person can do as much as how well a person is. It can take a little while to move from a purely disease model approach that is learnt in medical school to a functionally orientated health outcome approach that is learnt in a rehabilitation training program. Being in the privileged position of looking after the health of a person does not stop with looking at a diagnostic test result or writing a prescription. It is about understanding the person, who they are, what they want to do, and how we can help them to achieve their goals. As well as being a training body, other roles of the faculty involve advocacy and acting as an authoritative medical body for people with disabilities. Many of our fellows are dedicated academic researchers who are trying to find better ways to improve the health outcomes of people with disabilities, and through our association with the Australasian Rehabilitation Outcomes Centre at the University of Wollongong, we are researching more effective and efficient models of healthcare delivery for people with disabilities. If what I have said interests you in learning more about our faculty, or if you are a doctor interested in a career in rehabilitation medicine, contact our office in Sydney on 02 8247 6216.